Human metapneumovirus is a respiratory virus that primarily affects the respiratory tract, causing illness ranging from mild cold-like symptoms to severe respiratory issues. Discovered in 2001, it is a common pathogen, especially in children, the elderly, and the individuals with weakened immune system. Here's everything you need to know about HMPV. Overview. Full name: Human Metapneumovirus (HMPV). Family: Paramyxoviridae. Genus: Metapneumovirus. Type: enveloped single-stranded RNA virus. Transmission: person to person via respiratory droplets, direct contact, or contact with contaminated surfaces. Epidemiology. Number 1. Prevalence. HMPV is a leading cause of respiratory infections globally. Infections peak during the late winter and early spring, similar to influenza and RSV, respiratory syncytial virus. Number 2. Vulnerable populations. Young children. Most infections occur by age 5. Elderly individuals. People with compromised immune systems or underlying conditions like asthma and COPD. Symptoms. HMPV can cause a range of respiratory illnesses, from mild upper respiratory infections to severe lower respiratory diseases like pneumonia. Symptoms usually appear 3 to 6 days after exposure and may include mild symptoms: runny nose, cough, sore throat, fever, fatigue. Severe symptoms: in lower respiratory tract infections, wheezing, difficulty breathing, or shortness of breath. Bronchiolitis, especially in infants. Pneumonia, severe cough with chest pain. Hypoxia, lower oxygen levels. Diagnosis. Number 1. Clinical presentation. Symptoms may overlap with other respiratory viruses like RSV, influenza, or COVID-19, making clinical diagnosis alone challenging. Number 2. Laboratory test. RT-PCR, reverse transcription polymerase chain reaction. Most sensitive and specific tests for detecting HMPV RNA. Antigen testing, less commonly used due to lower sensitivity. Viral culture, used in research settings but not routine. Treatment. Number 1. Supportive care. Hydration to prevent dehydration. Antiviretics for fever management. Example: acetaminophen or ibuprofen. Oxygen therapy for severe cases with difficulty breathing or hypoxia. Bronchodilators may be used in cases for wheezing, though efficacy is variable. Number 2. Antiviral therapies. Currently, there are no specific antivirals approved for HMPV. Research is ongoing. Number 3. Hospitalization, required for severe cases, especially those involving respiratory distress or complications like pneumonia. Prevention. Number 1. Hygiene practices. Wash hands frequently with soap and water. Avoid close contact with infected individuals. Disinfect frequently touched surfaces. Number 2. Infection control, mask and respiratory etiquette. Covering coughs and sneezes can help reduce spread. Number 3. Vaccine development. No approved vaccine exists for HMPV, but research is underway to develop vaccines targeting this virus. Comparison to other viruses. RSV. HMPV is closely related to RSV and causes similar illness, particularly in young children. Influenza. Unlike influenza, HMPV does not have seasonal vaccinations, and its symptoms are generally less severe in healthy individuals. COVID-19. HMPV infections are not associated with systemic complications like COVID-19, but can still cause severe respiratory issues in vulnerable groups. Complications. Number 1. High-risk groups. Infants and toddlers may develop bronchiolitis or pneumonia. Elderly individuals with weakened immune systems are at risk of severe disease. Individuals with chronic respiratory diseases may experience exacerbations. Number 2. Secondary bacterial infections can occur in severe cases requiring antibiotic treatment. Prognosis. Mild cases usually resolve within 1 to 2 weeks without complications. Severe cases can lead to hospitalization, especially in high-risk groups, but with appropriate care, the prognosis is generally good. Key facts. HMPV is a common but under-recognized respiratory virus. It is often mistaken for other respiratory viruses due to overlapping symptoms. While severe cases are rare, the virus can pose significant risks to vulnerable populations. Public health measures, hygiene, and supportive care remain the cornerstone of managing HMPV infections. If you suspect an HMPV infection, consult a healthcare professional, especially if symptoms are severe or persistent.